Hi guys, Nurse Amy here. You're not going to hear my voice too well because I'm going to talk about a procedure that I just had about 6 hours ago, and that is a colonoscopy. Amy Alton, I'm a nurse practitioner, and yeah, I just had a colonoscopy. My throat is killing me. Thankfully, it's the only thing that's bothering me, so I'm sorry if my voice is a little scratchy. But I wanted to talk about this on the day that I had it done because I'm not sure I'm going to remember all the details in a few days. You know, the anesthesia might make me forget. So while it's fresh, even though I have like no makeup on, my hair probably looks ratty, whatever. I don't care. I am here to talk about not all the technicalities of colonoscopies. My husband can talk about that, but I'm here to talk about me as a patient experience and what I went through with the prep and which prep I used and how I kind of changed it up a little bit and what worked for me as far as drinking it and the results and the timing. And also, if you are on one of the GLP-1s, what you should do a little differently than people who are not on it. And I know a lot of people are on it, so I want to tell you what I did. And I think it was really important for me to change up my doctor's instructions, because if I would have followed his instruction, I would still have been sitting on the toilet, unable to get in the car and go to the hospital at the time that I needed to be there. So I was given a choice from the big one, which I actually have for Joe, because that's the one he chose, or the 2 prep split. And let me just show you the box. And it looks like this. You have 2 of these. They're 6 ounces each versus, oh my gosh, the one he drinks is like a gallon. So you take one of these. The instructions that were given, actually, you know what, let me back up. So this is Wednesday. Yesterday, I couldn't eat any solid food. So I was not allowed to drink milk, drink or eat anything, because you can't eat any solid food anyway, but you can't drink anything that's red or purple. And you can't have any alcoholic beverages, which who wants to do that on an empty stomach anyway? You are allowed to have water, strained fruit juices, no pulp. Like, you can't have orange juice with like pulp. I wouldn't recommend orange juice anyway because it's very acidic. It's not going to help you when it's coming out. Apple's okay. I did white grape juice. Actually, no, I didn't do white grape juice. I did white cranberry juice, which was really good. And I also bought a lemonade with sugar because you don't want to do diet stuff here. You're not having food. You need some electrolytes and you need carbohydrates, so that's important. Coffee or tea, you can have those, but they say not to put dairy or non-dairy creamer. Dr. Bones forgot that, and yesterday gave me coffee with a little cream, and I was like, well, it's in the morning. Everything's going to run through me anyway. What's a little cream going to hurt? And it didn't hurt anything. So I did have creamer and my coffee decaf, which they don't care if you have caffeinated. But I did have a little creamer, so I think that was my cheat. And then you're allowed to have chicken broth. And I did buy a couple of these bone broths. And you'll find that instead of just regular chicken broth, that things that say bone broth actually have more protein. And that's what you're looking for, because again, you're not eating. So I got my protein through these, and I know it sounds silly because you can just drink it through, you know, like a cup or something, but I put it in a bowl and I heated it up and I ate it with a spoon, just for the mind trick of saying this is a meal. So I did that just to feel like I was having some food. So I had 2 of these, and they are 19 grams of protein each. And I did have one little one, which is kind of looks like a little old-fashioned milk carton that they give to the kids in the schools. And then you can drink that. But I went ahead and poured it into a bowl and ate that with a spoon too. So, and that one is 10 grams of protein. So I had about 40, 50, little less than 50 grams of protein, which I spread it out through the day. I didn't just like all have it once. So I was sipping this through the day. So I had that. I shouldn't say sipping, using a spoon. So I was also drinking tons of water, and I have distilled water. So I had these electrolyte drops because you're not really getting electrolytes from anything else, and I use distilled water. Normally it's not a problem for me because I'm eating a variety of foods and I can get electrolytes from other things, but I have these drops. So I put the drops in the distilled water so that I was drinking water with electrolytes. And so what did I use the lemonade for? That is how I got through drinking this Disgustoness, which is actually sodium sulfate, potassium sulfate, and magnesium sulfate oral solution. Okay, so in this box comes these two 6-ounce bottles, and you're supposed to drink one. The instructions are, it's called Sure Prep Bowel Prep Kit. You drink one. The instructions are 1 6-ounce. You pour that into, this is provided for you, this cup here, and it fills up about that much, and then you're supposed to fill the rest up with water. What I did was I filled the rest up with lemonade to here, and then what I did was I split that amount into another cup, a big cup like one of those red cups that you use for parties, and then I filled that up with lemonade. Also filled both of them up to the top with lemonade again. So what I was getting was 2 16 ounces. So basically the 6 ounces was split between 2 cups. I mean, if you want to pour half of it in one cup and half of it in the other cup, that's fine. I just happened to think of splitting it after I had filled this up with lemonade already. But the lemonade really helped the flavor, surprisingly, because I know that this stuff tastes like nasty. One thing I did for Joe when he was bowel prepping for his first colonoscopy, and he was using the big one, is I took a red cup, made the amount you're supposed to do. I forget what it is. It's like, I can't remember. But it's a similar cup like this. And in the cup that you put the bowel prep, I added 2 tablespoons of margarita frozen mix. Now, those don't have alcohol. Those are those little canisters, little cans you find in the freezer section to then add alcohol to if you'd like to, but that's not what I did. I took 2 tablespoons of that mix, that frozen mix, put it into his prep, stirred it up, and then stuck it in the freezer for probably 20 minutes. Took that one out. While he was drinking the frozen one, I made the next cup, put that in, because you were supposed to space those out. I don't remember how often you were supposed to space those out. It's been so many years. But between drinking, I had one waiting for him. So as he was drinking one that was partially frozen, so it did taste like a margarita, I put another one in there. So that's a hint for doing the full prep. What I did was just use lemonade. Now I could have put it in the freezer for a little while, made it a little frozen. Maybe it would have tasted a little better. Probably similar to the margarita because I was freezing lemonade, but it was pretty tolerable. So you have to drink the 6-ounce filled with water fully, which remember I split it, and then you have to drink 2 more 16 ounces. But by splitting this and filling it up, I got 2 16-ounce cups. So I only had to drink like 1.5 more. It was a little bit of this 6-ounce, but 2 more 16-ounce cups. So I drank this, 2 of them, pretty much immediately. It wasn't too bad. My stomach got pretty filled up about halfway into the second one of these. But you have an hour to finish it. So within the hour, you need this with this, plus 2 more fluids. So I did both of those with the lemonade. Not bad. So I finished that, I would say about 6:30 last night. And I waited around. I was like watching television. Joe's like, is anything happening? I'm like, no, nothing's happening yet. About 9:30, the first incident, we'll call it, issue, situation, we're not going to use like weird terms, to the bathroom. So you can imagine what it is the first time, half an hour later is the second time, 15 minutes the third time, and then sometimes you can't move because every 2 minutes something's coming out. And it starts doing that, so it starts getting closer and closer and closer. Still didn't look clear. What it's supposed to look like is almost clear water, maybe just slightly yellow, almost the color of urine. It could have a few flecks, and you'll understand that if you go through a prep what I'm talking about, flecks. But I didn't quite get there. I was supposed to take the second one, complete the second one, start the second one 4 hours prior to my appointment. So my appointment was 10:30 this morning. So I was supposed to get up at 6:30. Now, mind you, it's 11:30 and I'm still having my situation. So I'm thinking, how am I going to get any sleep? I got to get up at 6. I got to, finish this. So anyway, I said that this is like no sleep. I'm not going to be able to finish this in the morning. I'm going to be too tired to get up. So I made a decision, because I am on Mounjaro and because I do have slower emptying of my stomach. By the way, you have to be off Mounjaro at least 7 days. They don't tell you that. They say don't be on Mounjaro. So I just skipped my dose for Saturday, and this is Wednesday. So we're about, 10 days. Didn't take the Saturday. So we're 10 days since my last shot. And they were totally fine with that. But I'll tell you what, I still have gastric slow emptying, which is why it took so long for this prep to work. So in my case, I said 11:30, okay, this is not clear yet. I know I'm going to have to take the second one. Instead of waking up at, God knows in the middle of the night, 4:30, let me just do this. So I went, I got the second one, poured it in, split it, filled it up with lemonade, did a whole nother lemonade, and then I actually drank more electrolytes too, because I really wanted to flush. I want to make sure I don't have to go back. They don't go in there and say, oh, we couldn't see anything, we didn't know what was happening. So I really, really needed it to be clean. So 11:30, I drink the second one. 11:45, I have to go again, and it looks great. I'm like, oh no, I took the second one. I really didn't need it, but I had already done it, so what are you going to do? So I was up till 4 a.m. That's why I also sound terrible. 4 a.m. Sitting on the toilet, on and off, on and off, on and off, on and off. And poor Joe, he's like trying to stay awake. I'm like, he's fully dressed in case he has to take me to the emergency room because I was having some heart palpitations after the second dose. I don't know if the magnesium did something to me. To counteract that, I actually took a couple of Tums because calcium counteracts magnesium. So it calmed all my weird palpitations down, and I was having some weird heartburn too. So anyway, Tums was great. I got him to go to sleep. 4 a.m. last time, I slept for like 3.5 hours. Got up, got ready, brushed my teeth, put some clothes on, comfortable jammies, top because I wanted to be warm. I put socks on to make sure my feet were covered. I took off all my jewelry, my wedding ring he wore for me, which is so sweet. And we went to the hospital, checked in, sat in a crowded waiting room. Actually, didn't sit in the crowded waiting room, stood in the hallway because I didn't want to sit in the crowded hallway and end up getting something from one of those people. So we stood in the hallway most of the time. Then there was one seat that opened like by the door. So I sat, he stood because he's an angel. And then they called me. And I had asked at the desk if he could go with me because I've never done this before. And even though I'm in the medical profession, you still get nervous, you know? You want your person with you, whoever that is. So I asked the nurse. I was really nice. And they don't usually let people in. You seriously have to ask. So I said, listen, can my husband come in? I'm very nervous. I haven't done this. I am a nurse practitioner. I know it's happening, but he's a doctor and he's also nervous, and we usually do things together. So we support each other. So she was really sweet. She let him come in before they started my IV, thank goodness, because I was holding his hand as she put that, giant, not kidding, it's that long needle, and then they take the needle out. By the way, they just leave a rubber or a catheter in there. It's not rubber. But anyway, so he held my hand. They put the IV in. She asked me a bunch of questions. When's the last time I ate food, which was Monday? When's the last time I took Mounjaro? Am I safe at home? Which is a very interesting question. They asked me that before he came in. Am I safe at home? Yes. She asked me that twice. I was like, yeah, I'm safe. Do you see bruises? Like, I'm good. But then they let him come in when they got a bed for me, and he was there for me. The anesthesiologist came in, asked me questions, told him about the Mounjaro, told him about my allergy to Reglan, which is a weird allergy, and no other allergies. They always want to know that. And also, when's the last time you ate? They're very, very careful because they don't want you to aspirate. They're just giving you some IV anesthesia. They're not intubating you. So if you throw up or choke on something and it gets in your lungs, you can get an infection. That's really dangerous. So they want to make sure you haven't eaten. Super important. And then it didn't take long. Oh, actually, I had low blood sugar. My first blood sugar from my IV, because I had type 2 diabetes before I started the Mounjaro, was 33, which is way low. Minimum, before they put you in surgery, they said has to be 70. And so mine's 33. And she's like, no way. And I'm like, well, I am dizzy and you guys told me I can't eat. So yeah. And I had nothing to drink after that. The last time I went to the bathroom at 4 a.m., I had a last gulp of water with electrolytes, and then I had nothing else to drink because I didn't want to have anything on my stomach to come up. So that was 6.5 hours before the procedure. So they did my blood sugar. It's super low. Now they have to go to the pharmacy and get a syringe of glucose. I was like, oh no. She's like, how do you feel? I'm like, I said the S word, S-H-I-T. I said, that's how I feel. She started laughing. I'm like, well, you guys don't let me eat. I'm dehydrated. You know, I'm completely cleared out. What do you think my blood sugar is going to be? So then she's like, well, let me do a finger stick, because she didn't believe it. And then she did the finger stick here, and I have a nice little bruise there. It was 38. I'm like, okay, 33, 38. I think we're kind of low here. So they have to wait. The anesthesiologist comes back in. Now everybody's like in a panic because of my low blood sugar. Everybody asked me how I felt. And every single time I was like, how do you think I feel? Like, and I said the word. I'm not going to cuss here, but I did say that word because I thought it was funny. I'm like, what do you think? I'm a little dizzy. I have a little headache. My blood sugar is low. Durr. So anyway, they bolused me with this syringe. They gave me half of the syringe. She said that she raised it about 50 points. And then they rechecked it, and it was 108. So that was good. Got into the OR. They put a pad underneath you, a big plastic pad, in case you have things come out. And we're going to keep this clean. And they're very nice people. They re-ask you your name, ask you your birthday, ask you what you're having done, so they make sure everyone's on the same page. Then the nurse at a computer does safety checks. Does everyone have their equipment on? Is this done? Is this plugged in? Is this... she goes through this checklist, and everyone has to answer, which was really nice. There were 3 nurses and the doctor. One of the nurses was an anesthetist, so she was a nurse practitioner too, which it was nice. Super nice, chatty, made me feel very comfortable. They put a nasal cannula on for oxygen, which is why I have this super, super dry, sore throat. I've never had a sore throat. I've had strep throat. I had COVID once in December before Christmas, but this is beyond sore, painful. It's hard for me to talk to you guys, but I wanted to so I could tell you everything. All right, so they put the cannula on, then they turn you on your side. I asked for a blanket to go between my knees because I have, all my lumbars have herniated disc, so I didn't want to be too twisted and have back pain when I was done. So they were really nice. They put a blanket between my leg, a folded up blanket. So I turned over, and then she said, all right, I'm giving you the medicine. And literally you just feel like a little rush through your arm, like a real hot feeling, which actually I also felt with the glucose. But this hot feeling through your arm, and then you're just gone. And then next thing you know, you're waking up back in the same little waiting area that you have with the curtains, so you're like 3 feet away from everyone else. The privacy. So you wake up and the only thing I could tell was my throat was, I'm like, did you guys intubate me? She's like, no. I'm like, my throat is killing me. Nothing else hurts. People talk about having to pass gas or cramps. I have nothing. I have not passed anything. Nothing. I just have no pain, and I have a history, really bad history of IBS. Terrible cramps, horrible pain, bouts of constipation and diarrhea alternating over my life. I expected the worst. I expected to wake up in terrible pain. And the last thing I said to the doctor before I went under was, please be gentle with me. So he's funny. He's very funny. He said to all the nurses, he goes, you hear this? We have to be gentle this time. I was like, yes, please. So that was the last thing I heard from the doctor. But I'm shocked. I'm really shocked. I have no cramping, no discomfort, nothing on the outside, nothing on the inside hurts. Like I said, nothing except my throat and my mouth. I can barely talk. This hurts so much to talk to you guys. You don't understand. So I talked about not eating on Tuesday and doing the prep and how I did it a little bit differently. Like I said, they wanted you to do it, 3 or 4 hours before the time. But I knew with my slow gastric emptying that I was having delayed reactions to this and that I was going to end up being still on the toilet when we needed to go. So I moved it from that 4:30-ish time, 5:30-ish time to 11:30 at night just to get it over with, which I think was a great idea. I'm really, really happy I did, because the pictures they gave me that I have, which I'm not really going to show you, but I forget where I put them. I thought I brought them in here. Anyway, the pictures are so clear. Oh my gosh. It's like I have the emptiest bowel you've ever seen in your life. I went in and did this, not routinely. Obviously, you're supposed to do it at age 50. Recommended. Every once in a while I have 45, but 50 is routine. I am 59 almost and a half. So, should have done a long time ago. But I was having rectal bleeding. And when I say rectal bleeding, it was mixed in. It didn't come out. It was mixed in with what did come out. Again, trying to not be too graphic here. So I had an indication of going in. So I did expect to have a polyp, some polyps. I had 4. They were like 5 millimeter, 6 millimeter, 10 millimeter, and 20 millimeter, which is a pretty good size. They took all of them out. The 20 millimeter, they cauterized when they took it out. They have like this little loop that burns it as it comes off, and then it, prevents bleeding, which I don't have any of. Knock on wood. He said, and then he came in. He came in after I woke up, and they knew I was kind of with it, and I could listen. And he said they look good. He said they look clean. They look normal tissue. They look like polyps. This guy's done hundreds, probably thousands of these colonoscopies. He's not young, and I trust him to know what he was looking at. And from the pictures that I see, they look fine. I'm not worried about anything. And it was nice that he reassured us. If he was suspicious, he would have said, well, this one we're sending to, they send them all to the lab. They always send them to the lab. But he could have said, this one here is a little concerning. That's usually if you hear concerning or worrisome or, well, we're not sure. You hear those kind of words. You're like, okay, we'll wait. And they said it'll take about a week. So if I had something suspicious, I'd have to wait a week, which really stinks. So thankfully, I feel very comfortable that nothing's wrong except this sore throat. So I want to tell you what I just did. Water hurts. Soup hurts. Soup is a little better, like just chicken broth. Don't try to eat anything else. I put a little piece of cracker in my mouth, and it turned to like sand or like cardboard because my mouth just sucked everything out. There's no moisture in my mouth at all. Anyway, I took a little bit of water in a bowl that was probably about this size and microwaved it for 2 minutes. Just probably 2 cups of water. I don't think it was boiling, but it was steaming. And then I got back in bed, which is what I just did before I came here. And I just pulled the sheet over my head. And what I did was I breathed out. I exhaled pretty heavily into the water. So it kind of made some more steam. And then I would inhale the steam. And then I would, just breathe normal. But, breathe into the water. So your head's kind of like this. Don't burn yourself. And I didn't make that boiling water. If you accidentally touch the super hot water, you might burn yourself. So put your head in, but, make sure you're not touching the water. That's why I only put 2 cups in this giant bowl. And then you got to cover the front up, because if you breathe out and the air your exhale doesn't hit the water, it's not going to get some humidity, because that's what you want. You want to breathe back in humidity. And steam inhalation, I'm going to spend the next 4 hours doing steam inhalation, because this is awful. So anyway, not the glamour video. I just wanted to talk to you guys. I'm sure after I tell him, because he doesn't even know I'm doing this, he's on the computer doing constant contact for an email output newsletter. So when I go back in and tell him I recorded this, he's probably going to want to do an official colonoscopy video. So you may see something more technical, something more, what they do, what they're looking for, what the scope looks like, where do they go. I don't need to tell you all that, okay? You can Google that if you want right now. But I wanted to tell you my experience with the split prep, how I moved the time, why I moved the time, how it worked for me, how long. So basically I was going to the bathroom from 9:30 p.m. till 4 a.m. That's a really long time to be on and off, mostly on the toilet. Yeah, it's a long time. So bring your phone or an iPad or a magazine or a book. Or a book. You can read a book. Probably get through the whole thing with that many hours. And relax. Don't plan anything for the day you're starving yourself and drinking this stuff. Drink tons and tons of water. Get electrolyte drops. Add those to your water. It just helps, it'll help you not feel so dizzy, so lightheaded, hopefully prevent a headache. And I did do quite a bit of protein. And like I said, pick the bone broth instead of just chicken broth, because it has a little more concentration of protein. But you can't do any other food. We did buy some Jell-O. I was not allowed to have, what was it? Red and purple. Oh, so he bought me lime Jell-O. So I have lime Jell-Os in the refrigerator. Actually, that might be good on my throat. So anyway, on the way home we bought some soup, and that's what I was drinking. I didn't eat any of the noodles or anything, just the broth. Oh. Anyway, so that's my experience. Not as bad as I thought it was going to be. Post, I'm fine. I was so worried about pain because I have IBS. I was like, this is going to be horrible. Nothing. So good. So good. If you've got to do one, this is not a bad thing. The amount that Joe has to drink is like, oof, I don't know that I could do it. This is more tolerable. Again, these are each 6 ounces. And then you fill this up, and then you have to get 2 more waters each time. But anyway, all right. Bye, guys. Thank you for listening. Thank you for watching. I appreciate it. And subscribe to the channel if you can. Thank you. Bye-bye.